Good evening. I'd like to call the Board of Health meeting on Monday, June 9th, 2025 to order. It is 6:02 p.m. And we will roll call in. Stephanie Granger here, Dr. Gopal,
Here.
Joanne,
Here.
Michelle,
Here.
and Megan.
Here.
Wonderful to see everyone tonight. And our first agenda item is open forum. Is there anybody with a question?
I don't see anyone with any questions at this time.
Okay. Then with nobody here for open forum, we can move to the next agenda item, which is the minutes from May 12th. They looked good to me.
This was for Abby's first.
I was going to say, is this
Don't
Abby's
be kind.
They looked good.
Joanne?
Well,
The only thing that I saw under the mosquito piece was when it, and I can't bring it up to quote it, so if somebody could look at it.
I'm
It
looking
would-
at, what are you looking for under the central mosquito thing? What do you
It
want?
was, when they were talking about the different activities that they did, and it
Yeah.
was like larviciding, blah, blah, blah. And then
Yep.
it said adult behavior or something.
It says adult control. So it's I think the section you're referring to, these services offered include surveillance, public education, ditch maintenance, larva control, source reduction, beaver mitigation. This is the one you were thinking of, but it says adult control and research and efficacy. Is that?
Yeah, I think we need to explain the adult control. Just
But mosquito or?
Adult mosquito.
Yeah, it's
As opposed to the public.
for adults and what they're doing. That's all.
Having worked at the State Department of Public Health eons ago, where we were in charge of the Eastern equine encephalitis and West Nile virus, they would trap the adults and then they would test them to see
Yeah,
if they
yeah.
had the virus. So I'm guessing that's what that means.
Oh yeah, I know what it it means. It just reading it just struck me kind of funny.
Just in case it's, okay, so clarify it with mosquito.
Yeah. For anybody who wouldn't know what that means.
Any other comments? Okay. Would anybody then like to make a motion to accept the minutes with that one?
I can. I'll make a motion to approve the March 12th meeting notes with the addition of the adult mosquito control.
I
Okay,
would like to
motion.
second that motion.
And seconded then. Great. All in favor, Stephanie? Yes. Stefan?
Yes.
Joanne?
Yes.
Michelle?
Yes.
And Megan? Great, thanks. That passes unanimously, and great job, Abby. Thank you.
And if I may, thank you very much, since I wasn't at the meeting, that nobody nominated me to be chair.
I had you up
A
for
long time.
secretary.
Yeah, I saw that. Yeah. Great.
Well, then we can move on to the Upper Merrimack Valley Reserve Corps update with Nancy Burns. And did we have her here with us tonight, Ray?
We do. Let me just promote her. So I think we talked about it a couple of meetings ago about the MRC. I know having a few relatively new board members, it's important to kind of be up to date with some of the projects here and folks that are working here at the health department. So I've asked Nancy if she would be willing to come to this meeting to talk a little bit about the MRC. She has about a 5-minute PowerPoint presentation, and then any questions, concerns, or anything you want to talk about. She's here to help. So Nancy, let me bring up your PowerPoint for you.
Welcome, Nancy. Thank you for joining us.
Do you want to introduce yourself, Nancy?
Sure. Thanks, everybody, for giving me time in the agenda, and thanks, Ray, for setting it up. My name, of course, is Nancy Burns, and I've been the coordinator of the Medical Reserve Corps unit based at the Westford Health Department since March of 2004. So it's great to have been around for a long time. So I'll try to keep this brief. To keep things in context, you might want to know a few things about the National Medical Reserve Program. So you'll see how our unit fits in and why MRCs matter. If you want to flip the slides then, Ray? Oh, go back one, please. There you go. The Medical Reserve Corps program nationally started as a direct result of the events of September 11, when well-meaning people rushed on the disaster sites. Some were helpful, but as a group, they didn't know ICS, they didn't know the lingo, they didn't know safety issues like what to bring to a disaster, wear a hard hat. So someone got the idea, why don't we take the goodwill of these people who want to help at pretty much every disaster, recruit them, train them, have them understand the organizations they might be working with in general response concepts, and the Medical Reserve Corps was born. There are now 734 units, give or take 33 in Massachusetts. And as Joanne well knows, sometimes they merge, sometimes they split, sometimes they disband, or they're new. The number's been relatively stable, around 32 to 34 for the last several years. There is 275,000 members across the national network. Over 3 million hours were served in COVID alone. And Ray was around when we were jumping through hoops trying to do all the response and putting in plenty of hours. Unit sizes raised, they really run the gamut. Our unit has, give or take, about 675. Nobody ever leaves out of dissatisfaction. They typically move. Other people join. MRCs are in 49 states. South Dakota's always been the holdout, and 7 protectorates basically around the world. We transitioned after our first 10 years from being a Surgeon General office organization to something called ASPR. Don't worry about that acronym. It's going to change anyway. Next slide, Ray, please. So people are a little bit surprised when they think Medical Reserve Corps, then everybody must be a nurse. If you look at this chart, this has been consistent throughout the years, the mix of organizations. What's the big one right there? Support staff, non-medical. And if you think about a hospital, it's not all doctors and nurses. There's legal, there's greeters, there's housekeeping, there's database people. There's a wide range of functions to provide the care and make sure that keeps going. Vendors, whatever. Now, the biggest professional category in our unit and nationally is nurses. We have a little bit over 200 nurses of various kinds, nurse practitioners, LPNs, registered nurses, and so forth, family nurse practitioners. Another big group is other public health and medical. That could be maybe x-ray techs and CMAs and such. EMTs like myself still make a sizable group as well. So it's not just one category. It really runs the gamut, and we need all of them. In a disaster, you don't know what kind of skills you might have to tap. Maybe you need people that are good with childcare. Maybe you need people with other kind of skills that can build stuff or drive CDLs. Next slide. So our unit, the organization reports to Ray Dick right now. We report to the Westford Health Department. We started as a 3-year demonstration grant. It was issued in September. It required getting a lot of letters from Senator Kennedy and a bunch of other people. So that they got us $50,000 a year for 3 years. We were one of the first 10 MRCs in Mass, and we're kind of finding our way along. We said we do a bunch of things. We did those and then some. We cover 7 communities with almost 300,000 residents, and you can see the data right there and how many people are in each town. Next slide. And this is a note that says we're a regional unit. Now, why don't we have each town for itself? Well, first of all, because it's regional, we overlap with a public health coalition that covers these same communities. So we get economies of scale. We also have consistent recruiting, credentialing, training. In the unit that I'm in, people are almost branded. They kind of know the drill. We make sure they have certain backgrounds and uniforms. We reinforce great working relationships because all these towns know us, and this encourages collaboration across projects. Next. So how are we funded? Following the money. We're grant funded. The 2 grants that we get that are administered by the state Mass Department of Public Health, and specifically OPM, the Office of something long, but they give us 2 grants every year. One is the MRC grant that they administer for about $17,000. The other, which is called FEP, which you've probably heard of in other public health issues, but that one's typically about 36,000. We also get grants all along from a group called NACCHO. ORA, or Operational Readiness Award grants, it averages about 10,000 a year. In the newsletter that we're issuing, and Ray has a copy of it, you don't mind me boasting, the camera ready copy is right here. We've been working our tails off to make sure every last detail is there. I was an English major, love doing newsletters. There's data, there's stats, quotes, you name it. It talks about ORA and NACCHO having given us money for the last 10 years. And some of the amounts have been sizable, like this RISE grant that we got, which is a $75,000 grant from ARPA funds. They still had funds to give out. So they said, all right, here's the supplemental grant. Both times we bid on the maximum amounts. We've got a great track record. They gave us everything we asked for, which was a really nice gift. There's also something that the state is administering that all of the MRCs benefit from, strong awards. And again, we won't get into the acronym, but basically every state could apply. Our state asked for 840,000, and they're using it for a lot of things that benefit all the units, from training, supplies, additional enhancements to the website and documentation. Next slide. And I don't expect you to read this. I would assume that we could make these slides available if anyone was interested. But this just gives you a general sense of what we do over the course of just this last year. We do 100 million flu clinics. That's our bread and butter. It does make money for the town, but basically this is the way we keep hundreds, if not thousands of people every year inoculated against diseases, especially the flu. During COVID, we were like one-armed paper hangers trying to keep up with it all. We offer a lot of classes, from heart association classes like first aid, CPR, basic life support for advanced medical. We teach Heart Saver classes to town employees, to the public, to hostess students, high school kids, and they're pretty amazing. We have a lot of classes that we're training people in leadership and clinical skills through a very advanced organization in Rhode Island called Tilly. We go to a lot of meetings. Ray and I do a lot of work behind the scenes so that our people can respond smoothly. Outreach and partnerships, that's just a little smattering from this year alone. LOSS is one that I'd like to highlight. It stands for Love All, Serve All. It's a group of volunteer Indian physicians that have a clinic twice a year in April and October. We were the first people to be invited. We've done it every single time that they've had it, twice a year. We've provided about a dozen medical members, and we want to do this. It serves the greater Lowell population of the medically underserved. And if we get like 300 people that we've seen at a given clinic, that's wonderful. They don't even know that they have really chronic and serious health conditions sometimes, and end up getting a hospital ride to Lowell General because, my gosh, your systolic blood pressure is over 200. My goodness, your blood sugar is like 500 something. These are really serious things. So it's great to catch them, treat them, and have these people go about their lives much healthier and able to take care of their families, their jobs, whatever. We also do a lot of things to support our members in between annual newsletters that we put out, a badging system, and uniforms that make them feel like they're part of a group, and they take pride in it too. And we try to have as many member appreciation events and emails and such as we possibly can. Next slide. Why does it matter to have an MRC unit? This is not something frivolous. This is something that's needed. We have become the go-to group for pretty much anything that you might need supplemental response capabilities. We're not looking to take anybody's job. We're looking to help people and offer things like the flu clinics that can only be done because we have 675 volunteers. And we don't have everybody volunteering every day, every year. We don't need to. We put out the call, and whoever's available that's trained and ready can do this. We don't arm twist, it's all voluntary. But people really enjoy being members. We offer surge capacity in disasters. You never know when we're going to get a snowstorm in October and Halloween, right? Or if we're going to get an ice storm and different, like Verizon and Comcast will be down for a while. We don't know what other hazards might come about. A toxic plume, like the first year we were there, that evacuated people to Songus Arena for a while. The first year that we were around, we barely got everybody trained. We didn't even have uniforms or badges. We basically had little stickers that had our name on them, and we hung onto our outfits with safety pins to say we're a Medical Reserve Corps. There was a shortage of flu vaccine, so we had to work with the health departments, make calls and staff phone banks to say, okay, we're screening people, and if you're in the right category, you can get the flu shot, and maybe they'll loosen up some more will be available. We're a general purpose resource. We're established, we're reliable. Everybody at the state, national levels who does this type of work knows us. We have a great reputation. And the summit that we just had, I put out a possible moniker for us, Saving Lives in a Shoestring. And the top levels, they really like that because that is what we do. The national program from the beginning has gotten $6.4 million a year, no matter how many units we have, no matter what we have to do. So it's almost like we have to go around with our tin cup and make this work. Or we get these grants from NATESHO or look elsewhere for grants. Some people have other supplemental funding. Next slide. To keep this brief, I'm going to have Ray just pop these slides up for about 10 seconds each. You'll see pictures of what we do, so you get a sense of these aren't just numbers, these aren't just names in a list, these are human beings that are dedicated to helping people. So this first one is just, we've had mega classes for CPR, we just had one for HOSA, we're going to have another couple coming up for the facilities department with Bill Bennett and Jeff Goodwin and so that's one of the things we do. Next. We practice our shelter skills. We've had emergency shelters. We've staffed at Blanchard. Some of them went for a week and a half. We want people trained and they know things like how to move patients, how to set up cots. The gal in the middle, she happens to be a pharmacist, but nobody has ego in this group. If you need to move the clipboards from point A to point B, I don't care if you're a brain surgeon. Could you please help move the clipboards? People are great like that. Next. And we support lots of clinics, vaccination clinics, cholesterol screenings, glucose screenings, you name it. Next. And we also support lots of health fairs, emergency preparedness fairs, outdoor events where we want to promote things like family fitness, better nutrition, be aware of your blood pressure, taking care of your health. And it means a lot more when our members talk to the press, as you can see at a fair with the cameras. It means more if they say that we're a wonderful organization than if Ray and I keep telling them, because we may seem like we have a vested interest as staff, but our members really care. Next. We also have been involved in what they call ICS, or Incident Command System drills. And this was an emergency dispensing site where if we had to inoculate lots of people quickly with a huge throughput, we logged all of that through Brian Eustace's organization way back then. And we even filmed how we did it upon request. And we got people asking, can I see the video? Can I see the video? It's on our website and in the National Toolkit. Next. We also staff sporting events, and this one happens to be from the Bay State Marathon and half marathon, and I got a kick out of hurry, we're cold. People have a sense of humor, it's fun, they like doing these. You can see that we treated people in the triage and medical tents. I ran it last year and I wanted to make sure there was somebody trained there to take care of me, and there were members, and that felt really great. Last summer, we also helped with the American Diabetes Association doing triage at their stations. Next. So we do a lot of that. And training, training, training. If it's not CPR, it's biochem, it's training day. And Ray was there and, was watching a lot of the seminars that we had. The plenary was great. The classroom sessions talked about everything from diabetes to heart issues and cardiac care. It ran the gamut. Next. COVID, COVID, COVID. We are so glad to have most of COVID behind us. Yes, it's still there, but it's endemic. We know more about it. We've got some vaccines and more protection. But boy, were we busy. What really was astonishing was people were willing to do whatever it took. We had around the nation, MRC units with people really wanting to help, doubling, tripling the numbers of some of these units. And the Saturday before Christmas that first year, I have a picture of one of our dentists and one of our psychologists out in the cold. It was like whipping wins, and they're with smiles on their faces among the many people that are handing out COVID test kits. That's gratifying. And of course, at the town meetings, we were handing out bug spray and masks and sanitizers, things like that. Next. Again, a wide range of things that we do, medical screening through these lots of clinics, community outreach at lots of outdoor fairs and indoor health clinics. We trained 12 Heart Association instructors, and then the trick is to keep them with their certifications every 2 years. We've had curriculums in mental health where we've invited the public, cooling centers when it was like the triple digits and high humidity and such, member appreciation events. We're always doing something. We're known nationally as being a very active and respected unit. Next. And some more things that we do, that TILI organization in the top line, it stands for Training, Innovation, and Leadership Institute. It's in Rhode Island. They've hosted us at the expense of their own strong grant to spend whole weekends learning about clinical skills and also learning about leadership skills. Very high tech. That itself is a lesson. We've done a lot of other things like the safe footing kits, made people in Westford feel like this town cares. 2 years ago, we had the idea, why don't we make the streets in Westford safer on icy sidewalks on their porches for our elderly. We don't want falls. Falls are bad. And we gave out what you can see here in the picture, the pet-friendly ice melt, a scraper, a tip sheet on how to avoid falls and what the resources are. If you need financial help, if you need sand, if you need other kinds of support in town, mental health, whatever, tip sheets. People were grateful, and they were able to get those for free because of various grants. This year, we upped the ante by doing 150 of these kits across 2 towns and better items in them. So we do a lot of things that people appreciate. Next. And the final slide is a smattering of a whole bunch of other things we do. The upper left shows the dentist and the psychologist handing out those kits on a freezing cold day, promoting 72-hour kits and preparedness. We've had presentations at Training Day and Active Shooters, flu clinics. Our training days are something to behold. We have a lot of people that we collaborate with. Marion Ryan was our keynote in the past. 72-hour kits, we've had seminars on that. The kind of training that I like to make innovative, I was driving through Tewksbury and I saw an equine center, and what do they do with that kind of therapy? Wouldn't you know, they support the same kind of population we do. Maybe people that have been veterans with PTSD, or people with Alzheimer's or autistic children. We learned their triggers. There are ways that you can deal with that animals can help them through this, and ways that we learn what the capabilities are. That was one of our most popular seminars. It's not sitting in a classroom looking at slides. They're petting horses and talking to people and learning some of these traits that are used that we can apply. And of course, Stop the Bleed and all sorts of things that we offer until help arrives to the public. I think that's my last slide, except for call us if you need us. I tried to keep it short. This is a smattering of what we do. We could go on, as Joanne knows, for hours in this, but she's been one of our members all along. And any questions?
Thank you. That was really great.
Thank you.
Well, thank you again for your time. And if you have any additional questions or would you like to get on the list for our newsletter, please send your name and email to Ray or me, and we'll be sure that you get a copy. We're also going to make them available online, post them on our website. So thanks again.
Yeah, I really
Nancy.
appreciate that. And emergency preparedness was one of the things that was high on my agenda all along, and it has made me feel much better knowing that we have the MRC in our area.
Thank you, Stephanie.
Ray, you have your hand up?
Yeah, I just wanted to add, thank you so much to Nancy for putting this presentation together. And Nancy is irreplaceable in my mind. She is, the program doesn't exist without her here in the Westford community, and she works extremely hard. But besides being a hard worker, she's extremely passionate, not only about the programs, but she can tell you everything you need to know about every member. She's very personable, and these people are good friends and like family to all of us. So we could not do our flu clinics here in town. As Nancy mentioned, not to go down that whole road, but sheltering and our cooling centers, everything. So really appreciate Nancy's efforts and wanted to say thank you.
Yeah.
Thank you, Ray. I get to work with some of the best people on the planet. I really do. So thanks again.
Thanks, Nancy. Okay, if there's no other comments, we really appreciate your being here this evening and sharing that with us and with the community. And it's wonderful, the work that you've done. Bye. Okay. All right. So I guess is old and new business the next?
Yes, yes. So
Part- yeah.
we do have beach testing and recreational camps for children. I just wanted to bring to this board's attention, our beach testing starts every year, Memorial Day to Labor Day. We do that testing for E. coli once a week at our town beaches. Typically, when we're in full season, it's 14 sites, separate sites. So that does take the staff about 3 hours, and they drop those off at the laboratory here. But I wanted to make you aware and the public's aware that that beach testing is posted every week on our town site under the health department. We do get lots of calls and emails, folks looking for that beach testing, are the lakes safe to swim in, that kind of information.
So
So
just to be clear, if they went to the health department's webpage through the town, where
yeah.
will they see the beach testing results?
And Abby, the beach testing is listed on the left-hand side or under, I believe it's under both. And we do have a beach heading. We have a table that has several, septic, water, wells, and
We have a
recreational waters. Sorry, Abby, go ahead.
Okay.
That's all I was saying. Sorry, recreational water. It's under that. We can always help someone if they can't find it though, if they just want to call.
Okay. Thank you.
Absolutely. So that's the beach testing and recreational camps for children. This year we have 7 camps. And so we wanted to make you and the public aware that both our public health nurse and our environmental staff does conduct inspections each year for our camps. It's quite the process. It can take hours for a new camp to help them through the policies and procedures. And so those camps will be listed on our website this year, the camps for children that are registered and inspected through the health department.
Thank you. The Instagram account.
So for the first time, we are going on Instagram. We've been approved through the IT and town manager's office to have an Instagram account. We've been working a lot with our communications consulting firm here in Westford. Our demographic, Facebook tends to be a specific demographic. We want to make sure we're reaching as much as we can of the population when it comes to the latest information that we're posting. So we have requested an Instagram account for that younger population. And so the hope is to whatever posts to Facebook, social media platform will also post to our Instagram account. So we are still in the process of putting that together, but just wanted to bring that attention to you all.
You're going to have the schools let people know that they can follow the health department on their Instagram.
We will. We will. We're not quite there yet. Right now we do on Facebook. We advertise that when we do community events. And we're pretty active on our Facebook social media account. But yeah, we don't have a social media manager here in the department, but I think it would be important to where they can be linked up. That would be helpful for us.
No. Did somebody have a comment on that? No. Okay. All right, then our flu season immunization order.
Yeah, so we wanted to let you know that we do have to place that order. Generally by June, we have to place our flu vaccine, our seasonal flu vaccine order for the fall. So it can be a little bit of a challenge to try to predict what the flu season is going to look like for the fall, but we do base that on our numbers for the following year. So we have placed an order for about 800 residents. That includes pediatrics. We see about 200 children a year as part of this order. We have had some folks ask about what the COVID vaccine looks like for the fall. Right now, we are hearing that it will not be available for the general populace. It will be available for folks that meet a certain criteria. And we're still waiting to get more information on what that looks like for the COVID vaccine. So if any residents have any questions, as soon as we have those dates, we reserve rooms at the Westford Academy to give that vaccine. And as soon as we have that information, we'll let you know.
That would be the flu vaccine?
That would be for flu. Mhm.
Okay.
Can I make a question or statement about the COVID one? Because
Sure, Stefan.
Ray, you were saying to the effect that it's not going to be recommended for as many people. Is that why? I know you said in the past we've also, and we do have to be responsible in not creating waste. And I know we don't get a lot of use or people taking advantage of COVID vaccinations that we have ordered. But I would like to get on record, and I hope that that's just because many people are turning to their physicians, or many of the pharmacies are taking up the slack with providing these. I think this was sort of a segue, if I could have 5 minutes to get something on record. Came out of a conversation that I had with actually Ray and Gail, the nurse, and some statements that have been coming out of the Health and Human Services and the head of the Health and Human Services that were confusing to us as healthcare providers, and concerning. And so I've been following that very closely. And again, I think we should only order what we think we will be using, but I think that it is also our responsibility to get the facts and the evidence-based recommendations out there that comes from the experts, the scientists, and healthcare providers. And actually, in trying to keep up with this and provide this educational information, I was happy when the CDC actually came out, and they are still making recommendations for most people to get this. And if I could take a minute, just when I was happily looking at the CDC website, because the two major groups that were of concern to me and Gail were recommendations that were coming from the head of Health and Human Services in relation to pediatric and pregnant patients. And so I'm actually on the CDC website and was very happy that it gives very good information right now that the COVID vaccination is safe and effective. It is recommended for most groups for 2024 and 2025. It's definitely especially important for high-risk groups, but there's still the recommendation for most adults over 18 and that are 18 and over to get that booster each year. And this is because protection from the COVID vaccination decreases with time, and also immunity from if you get an infection decreases with time. And so it's really important to consider this. One of the things that I really liked, and this was relatively new because this was going back and forth, but they've got it right up there on the CDC website, that it is especially important if you're pregnant, breastfeeding, or trying to get pregnant. So they are making recommendations that you get vaccinated if you are pregnant. And that the COVID vaccination is the safest, most reliable way to build protection, and it's better than getting sick with COVID. The other thing that I was semi-happy to see is that they did not say that it should not be recommended for healthy children. It actually, and this came out in the immunization schedules that go to physicians and healthcare providers. And what they've switched it to is that it should be a conversation between individuals and their healthcare providers. And where I would sort of like to end that on is that most of these recommendations from OBGYN, pediatric, family medicine, medical professional groups are recommending that pediatric and pregnant women get this. So several of the prominent OBGYN professional groups are recommending COVID-19 vaccinations during pregnancy, and many of the medical professional organizations, including pediatric and other professional groups like family medicine, are advocating and recommending continued vaccination for healthy children. So again, I am absolutely being on the board, recognize not wanting to not wanting to cause waste with getting vaccinations that we're not going to give out to the public, but at the same time, getting on record and getting this information out there to people in the public, that there was a very great concern between myself and many other healthcare providers, that there was going to be limitation of access to this to people that the medical professionals are still recommending get this. So I hope that wasn't too long. I just wanted to get that on record.
Thanks,
Stefan, I have a
Stefan.
question for you.
Yeah, absolutely. Who's that coming from?
From Michelle.
Michelle.
Okay.
So if I got the COVID vaccine last October, should I wait until this October to get a booster, or is there some kind of like timing that's critical?
So there was interesting. So this is where I always hated kind of trying to parse this stuff out when I was doing primary care of like what exactly are they saying. And I think they purposely a lot of times have a little bit of a gray area. And so what is tricky to tell is, and I don't want to speak as a healthcare provider. I'm speaking as a board member, and what I'm seeing on the CDC website is they're talking about that people get a booster that includes the 2024-2025 vaccination in it. And I'm trying to find it because I was actually surprised. Yeah,
The last I saw or
3
heard was
months. Sorry, go ahead.
every 6 months.
Yeah, and that's what I again personally always was recommending for people was every 6 months, but they have on here that if you wait, this is the one for if no, this is delaying it if you've been if you've had COVID that you wait 3 months. But there was somewhere on here that they were talking about booster since your last one. And I cannot find it right now, but I think that they were saying that you could get a booster as soon as 3 months after your last vaccination. So,
So not too soon to get it whenever you feel comfortable. Talk to your doctor, I guess.
yes,
Is,
I think that's the big thing that made me happy is at the very least it says this is still your decision to make with a healthcare individual, and is not being removed from your decision making capabilities and possibly from insurance coverage then.
And while we're talking about immunizations, again, I want to, as we read through the minutes from last meeting and talked about a 99% vaccination rate in our schools, want to encourage and applaud parents for vaccinating their children as we see what's happening with measles around the country, increased travel warnings regarding measles vaccines. Massachusetts is still doing well because we have a high rate of vaccination, and that is dependent on families continuing to vaccinate their children.
And Michelle, I think I just found what I was remembering, and it's a little bit different than what you were asking. And this was in relation to it saying if you had completed any of your previous series, that you wait at least 8 weeks before you get a booster. So I currently am not finding where they say when to wait to get that booster, that you just should be getting a 2024-2025 booster in most cases, if you're an adult, and that if you're a healthy child, you should be discussing it with your healthcare provider.
Thanks, Stefan.
Yeah,
Thank you.
absolutely.
And if I may,
Yes,
Yeah.
Joanne.
thank you so much, Stefan, for everything you just said. I don't know if anybody, or at least I know I couldn't have said it any better, more concise, and being appropriate without mentioning too many names. But we all know, I think, the amount of, I don't know where they distinguish the line between misinformation and disinformation and straight up lying And there's just been way too much lying about vaccines and other issues coming down from the person in charge of HHS. So thank you again. And I appreciate the fact that we've got on record and we stand united as a board regarding this issue. And I'm sure others that will come up that will affect us all in public health. But it's a scary time, and I appreciate all of you and all your work. So thank you again.
Thank you.
Thanks, Joanne. Any other comments on? Okay. Seeing none, I guess we can move on to the family bike rodeo event.
So the health department participated in the annual family bike rodeo event that we work with police, fire, community wellness. We had over 200 families that attended. It was a great event. We had 10, I believe it was 10 different vendors this year, which was great. It's an opportunity for kids to do a bike course that we put together and give away lots of prizes. We gave away bike and helmet gift certificates. We gave out bike helmets. So it was a really great event to be able to teach kids how to go through the bike course and provide them with a free ice cream, them and their families, and give out lots of education on bike safety. It was an opportunity for them to learn how to do repairs. We had a company come out and show them how to repair their bike and fill their tires. So it was really a nice event with toucher trucks and things of that nature. So just wanted to thank all the partners and for the opportunity to do that community event.
Sounds great. Okay, and then our Public Health Accreditation Board, Readiness Assessment and Training.
Yeah, so we wanted to give you an update as to where we stand with our accreditation. We are applying for December. Before you do that, you need to apply for readiness and training registration, which provides a few classes that our staff has to attend. Those are virtual classes. It's also kind of the ramp up. They provide you with lots of resources and things to ramp you up for accreditation application. There is a fee of $1,300 just for this stage, in which case we use grant funding for that. It's based on your population. So we're very excited. It's a lot of work, and as Abby can attest as well, it's a lot of meetings, and there's 10 different domains, and each domain has several, and I mean several sections of things that you need to have and written policies and procedures for your health department, how you're looking at data analysis, pretty much everything you can think of as far as environmental, public health, and community health. So we're really excited to keep the process moving. And with our consultant help, we are going to be officially applying in December. So just wanted to show you the congratulations letter and that we're moving along with the process. So
That's really
a lot
great,
happening
Lily.
in the background.
Bravo. And kudos to the staff. And it's a lot of
Yeah.
work.
It
It's a lot of
is.
work.
It's a group
Congratulations.
effort.
Yes, it's excellent. Excellent job.
Okay, and an update on the food inspector position.
Food inspector position, Abby, myself, have interviewed several folks who have applied for the position. At this point, our town manager did make a suggestion of looking at sharing the position with another town, a neighboring town. We did reach out to the neighboring town. They're not quite ready yet to share a position at this time. They do use a food consultant. Um, and so we were made aware of the town of Maynard, who is interested in sharing a position. So we're still in the investigative stage of that to see if that's something that would work for both communities. It's been a challenge to find someone who we can train and also could help us on evenings and weekends. Most folks are looking for benefits. And as you know, the position is not a benefited position. So yeah, we've gone out twice now for advertising. So just wanted to let you know that, we're working on that in the background. And certainly if that if it turns out that, we were able to do a shared position, we'll certainly bring that information back to you and so you can see the contract.
Thank you, Ray. Megan, you're muted.
Sorry. So would that be, I'm just curious, and maybe you don't know yet, does Maynard have somebody and then you'd end up sharing with them? Or would you?
My understanding from the town is that they need help with inspections that would fall under a health inspector or health agent, not just food. And so they are looking for as many hours as can be provided. Right now, I know they're pretty short with several positions. So working with them, they're very eager and excited to see if this can happen. So I'm not sure. Westford would be looking for about 20 hours a week, and which would leave 17.5 for the second community. But working out benefit package, how does that look like for funds? We both, ours is a union position. What does that look like for Maynard? And so still working out those details.
Did anybody else have questions on that? Creativity. Thanks, Ray.
Sure. Yep, we're trying to be creative here and how we can, we have a lot of weekend and evening events here, which is great. And post-COVID, as Abby can attest, it's kind of skyrocketed. We'll just say we see over 100 temporary events here in Westford. A lot of people just see things like the Strawberry Festival, but there's lots of things that happen at the schools and evenings, and so it's great. But someone needs to make sure the food's safe.
I've been trying out the new restaurants as much as I can, and as well as the old ones.
Yeah, there's a lot of new restaurants coming. We're in the middle of a lot of plan reviews, which is, again, exciting. It's exciting to see new business here in town.
It is. Thank you. All right, and then we have a correspondence.
So we did receive correspondence that was addressed to several departments and boards here in Westford. The Board of Health was listed as one from an anonymous resident. It is concerning about a project for 37 Powers Road. I did just want to bring this to your attention. This is a project where they're looking to bring in quite a few apartment buildings. They're concerned about several things in the letter, well water being one of them. I did reach out to the water department about this project. This project has not been approved yet. We have provided many comments. I know a question had come up about, does the health department see these plan reviews? So typically, if a project comes in and needs approval through planning, zoning, or conservation, they will reach out to us with all the information, and we'll have a comment period where the health department can make comments. And we comment from everything from asbestos, hazardous materials, food, depending on what it is. And so if it's something this board would like to see some of the bigger projects that we approve, or I should say not approve, make comments for, we're happy to bring that to this board. But this project, we provide comments. It has not been approved at this time. It is still being reviewed by the planning board, is our understanding. Again, speaking with the water department, they have a hydraulic study, impact study, that's being conducted because of the number of units and the impact on the water supply. Not only our aquifer, but what does that look like for irrigation wells? And so they had Tythe Bond, who is the consultant who is providing those results this week. They have not received those results yet. I know the town manager's office did put out a news flash today regarding the project that I believe it was the contractor for the project who was providing a balloon test of what the height of this project would look like between 4 and 5 stories. And that was from 5 to 7 tonight. So that residents could see the height of what the building, the height of the building that was proposed.
So, I mean, having read the letter, I have to say I agree with quite a few of the concerns mentioned, particularly as they pertain to water, which is a public health concern, our well water, our how both the draw on it and the risk of contamination to it. I think those are really valid concerns. Are those things that you brought up in your comments?
They are. This has come up before, the concern about the water supply with water restrictions. Speaking with the water superintendent for the water department, again, I guess this is why they put out an impact water study, a hydraulic study to see right now the town can, according to the water superintendent, this project particularly can handle 84,000 gallons of water per day. So they are looking at that. We're waiting to see what those results are. Um,
I mean, I really feel like if the town is looking at allowing these sorts of things to go forward, we need a backup plan for when our aquifer is insufficient. And I don't think there is one.
I agree, and I feel like as a board, we should be part of the review process, not just the comment process, because I think there were a lot of alarming concerns brought up in that letter.
I agree. And I don't like that. I don't know if there's any way we can be allowed to be more involved in these discussions. Previously, we didn't have a great experience with the planning board on another item, but so many of these things cross beyond one board, and to best protect and serve our community, the boards should be engaging together. And I don't know what the options and process could be for that.
I
Right,
do.
from the outstart, not at the end.
Okay, sorry. Okay, yeah, Michelle, I heard you. Joanne?
Michelle, were you done?
Yeah, I just said we should be involved from the outstart, not at the end, to comment at the end when the deal's almost done, as we've been in that position before.
Right.
Yeah. Yeah, but I was thinking back, on other big projects, Cornerstone for one, Newport for another, the quarry. There's been different big projects that we've been part of the process on. We've had joint planning board, select board, board of health meetings. And I'm not exactly sure where that fell off with these bigger projects. Because there's a history there that we have worked with the other boards in the process, as Michelle said, in the beginning, and not just commenting and trying to get ourselves to the table like the last issue that came up. So I'd like to try to see if there's a bridge we need to build somewhere or something to get us back into that process, because we've done it in the past.
Is that something like me setting up a meeting with Kristen and discussing this?
Sure. So we can certainly talk to the land use department and see, what the options are as far as moving forward, not only on projects that we provide comments on. We can certainly bring you a list of all the projects that are sent to us, and we can provide those each month, and certainly put any
But it's more than
information
just
in the packet.
providing those comments, I think is what we're saying, is that when they're considering these, it's great that you're providing those comments, but if the board, there are things that the board should be engaged with the other boards in discussing.
Absolutely. Yeah, so I can certainly check to see if this board would like to meet with the planning board. We can certainly suggest that and about this project. Where,
Yeah, and I think the
feedback.
bigger thing that, like Joanne was saying, is that we perhaps discuss what the process is for when it's appropriate to have the boards working together from the beginning on these discussions, rather than just a
Sure.
one-time thing, but that it would be better to have a process in place or an idea of how we work together more
For the most part, I think a lot of the projects that come that come in front of the staff, it's fine.
Mhm.
They can start the process, or it's something small and whatever, but it is a little bit alarming on these big projects, where there's going to be a lot of public health impact, that could eventually land in front of us, later on down the road for issues that we are not involved. So I agree, Stephanie, there's got to be like a threshold at which, yes, this is definitely a staff thing. They got it. We don't need to get involved. But when it's like this kind of a big townwide, there's got to be more
Where the
collaboration.
impact of the project and it impacts the entire town on,
Yeah,
that's,
yeah, or at least in this case, it's one section of the town. But and I think
our
maybe
water could be everyone.
drinking water. I mean, we knew with the perchlorate stuff, we went through all of that. But I think maybe it does start with a conversation with maybe the chairs of the board and Kristen or something like that. I don't think having a full dual board meeting, I don't think we're there yet. I think we have to start the conversation.
Yeah.
Like this is, has become an issue.
So Ray, maybe I can, with you, we can reach out to Kristen and discuss.
Absolutely. Absolutely. We'll touch base.
Sounds good.
Sorry, Megan, did you have something?
No, that's fine. I was just gonna say, is it better to do like chair to chair, or we could also just write a letter from the boards offering, and then once we're in person, I was just gonna also reiterate that if we were gonna have a joint board meeting, it'd be nice to have plenty of time to do research ahead of time. That's all.
Absolutely.
Okay, is there anything further on that? Would appreciate the concerned homeowner for reaching out. Because we don't always know things without people reaching out to us. So with that, I think, is that the end of our agenda then?
It is. Yep.
Right. Is there a motion to adjourn? No, we're going to hang out.
I can make a motion to adjourn.
All right, motion made. Is there a second?
I'll second.
Let me.
I got Michelle.
I want to hang up.
Sorry, Michelle seconds, and Stephanie, yay. Stefan,
Yay.
Michelle,
Yay.
Joanne,
Yay.
I, yay, sorry. And Megan.
Aye.
There we go. Thank you. All right, everyone. Thank you so much and have a good evening.
Take care.